All right. Hello, Miss Amanda. I have a doctor's order here to do a basic head-to-toe assessment. All right, so we're just going to be checking a few things. But first, can you tell me your name and date of birth?
Amanda Skaggs, 5/17/96.
Okay, and can I check your wristband? All right, just need those two forms of ID. Okay, so I said we'll just be doing a basic head-to-toe assessment. I'm going to be checking your head, your vision, your hearing, your breathing, checking for symmetry, sense of discoloration, things like that. And before I do this, I'm going to do my hand hygiene and put gloves on. And now some of this I'll have to like touch your head and palpate, percuss your chest and back. Is that fine?
Yep.
All right, cool. All right, we're going to start with the head assessment. Now I'm just going to look at your head, look for signs of symmetry and discoloration, make sure everything's good. Looks good. I'm going to run my hands through your scalp, make sure everything feels symmetrical. Palpating the scalp. All right, everything's good. Okay, now we are going to check your vision, make sure everything's dialing properly. Look at your eyes. Okay, now I'm going to turn the light out to check for contraction of your pupils. And okay, now they're changing a little. All right, that's good. All right. Now I'm going to use this pen light here. All right, and we're going to check a couple things. First, I want you to look straight ahead at this light, at this pen, and do not move your head. Just follow it with your eyes. All right, the eyes are converging properly. No restricted movements. Both eyes are following symmetrically. Okay, I'm going to use this light to check your eye constriction. Constricting properly. All right. Now I want you to keep your head straight and follow this light. All right, we're going to check your 6 cardinal directions of movement.
Okay.
All right, so up, down, left, right, diagonal, diagonal. All right, sorry, get the light out of your eye. Okay, your eyes look fine, everything's good, they're symmetrical, no discoloration, constricting properly, you seem to have full range of movement, that's good. Now I'm going to check your ears, pull your hair back here, check, make sure they look fine. Then I'm going to palpate your mastoid process. I'm going to check in the side here to look for discoloration or excessive wax, bleeding, rashes, anything like that. They look good. Check your other ear. Right. Any softness, tenderness?
No.
All right. That looks good. All right, now I'm going to check your nose, make sure your breathing's fine. Any softness, tenderness, anything like that? Okay, now I'm going to cover one nostril, and I want you to see if you can breathe fine out the other. Okay, I'm going to cover the other. Can you breathe? All right, no problem?
No problem.
All right, good. All right, now I'm going to check your neck for signs, discoloration, extended jugulars, everything looks good. Any softness, tenderness?
No.
You breathe fine?
Mm-hmm.
All right. I'm going to check your thyroid glands. No softness at all, no tenderness?
Mm-hmm.
All right, can you open your mouth? Stick your tongue out. Say ah. All right, no discoloration. Everything's good. You're able to stick your tongue out and say ah. That's one of your cranial nerves. Everything's good with that. All right. Now we are going to move on and put this over here. We're going to move on to checking your lungs and thorax. All right, so I'm going to get my stethoscope right here. And normally you would disrobe enough so I could see your chest and your back, but for this video we're not going to do that. So I am going to examine you to make sure everything looks normal. Signs of breathing look normal. No discoloration, no distension, nothing like that. Looks good. Can you turn to the side here?
Sure.
Alright, cool. Alright. Now I'm going to put my hands on your lower back at even spacing, and then I want you to breathe in deeply through your nose.
Okay.
Alright. Alright, sorry, in through your mouth. Okay, and I am checking to make sure there's proper lung expansion. It's symmetrical. It looks good. Doesn't seem to be any issues. I am going to percuss on your back. Tell me if there's any tenderness, any softness. Everything feel good?
Mhm.
All right. Okay, I've inspected. I've palpated. I've percussed. Now I'm going to listen to your breathing. So I'm going to clean the stethoscope, warm it up so it's not cold on you. And then I want you to breathe in deep and out through your mouth.
Okay.
I'm going to listen for a full breath at each spot, going from one to another per breath, down in a symmetrical pattern, listening to your breathing all the way down. All right. Now I'm going to come over to the anterior side of your thorax. I'm going to do the same. I'm going to inspect to make sure everything looks right. There's no distension, nothing like that. I'm going to palpate and percuss in a symmetrical pattern going down, and then I'm going to listen to your breathing while you breathe in and out slowly through your mouth with deep breaths. Listening for one deep breath in each place, going all the way down to each spot that you're supposed to listen to. All right. And your lungs sound good. You sound perfectly healthy. I'm going to hang on to this for a minute because I might need it. Now I want you to stand up. Okay, stand over here. All right, now lay down in the supine position. Okay, and we're going to elevate your head some, about 30 to 45 degrees as per your comfort level.
No.
Okay.
Let's use that pillow. I'll scoot up a bit.
There we go. Good. Okay. Now I'm going to check all your different pulse sites. I'm going to start with your radial by your wrist on your thumb side, then your ulnar also by your wrist on the opposite side away from your thumb. Then I'm going to check your brachial. I'm going to check both at the same time actually. I'm going to check both of your radial pulses. I'm going to check both of your ulnar pulses. I'm going to check both of your brachial pulses. Now, you can sit your arms down. Now I'm going to check your carotid. Now these I will check only one at a time so I don't cut off blood flow and you risk passing out. All right. Check your temporal pulse. All right. I'm going to check your femoral pulse. It's over by your thighs. I'm going to check your popliteal pulses behind your knees. I'm going to check your dorsalis pedis pulses on the top of your feet. I'm going to check your posterior tibia pulses behind your ankles. All right. And then I'm going to check your apical pulse. It's at the mid-clavicular line at your 5th intercostal space, and I'm going to listen to it for a full minute.
Okay.
Okay, so we're going to listen to that for a minute. And I'm going to go set this over here for right now. All right, now I'm going to palpate your aortic area. It's at the right side of the sternal border at the 2nd intercostal space. And I'm going to listen to your pulmonic area. At the left side, also at the second intercostal space. I'm going to listen to Erb's point down right below it at the third intercostal space. I'm going to listen to your tricuspid pulse right below it at the fourth intercostal space. And at the mid-clavicular line at this intercostal space, I will listen to your mitral area, also where I listen to your apical pulse. I'm going to palpate each of these areas, make sure everything's fine. Do you feel any sensitivity? Is everything good?
Mm-hmm.
All right, that's all good. All right. Now I think I need my scope again. All right, now that all that's done, we're almost done. All that's left is I need to assess your abdomen. And to do that, I'm going to first examine your abdomen area in each quadrant. And then I'm going to palpate. If you feel any tenderness at all, let me know. All right, I'm going to start with your right lower quadrant. Any tenderness?
Mm-hmm.
Move to your right upper quadrant.
A little bit.
A little bit, okay. Your left upper quadrant.
A little bit.
Okay. Your left lower quadrant.
Mm-hmm.
Okay. So here's a little tenderness here.
Mm-hmm.
How much? What's your pain level?
Moderate.
Okay. All right, now I'm going to listen to them. I'm going to auscultate. Going in the same order. I'm going to listen to your right lower quadrant. All right, I'm going to listen to your right upper quadrant. I'm going to listen to your left upper quadrant. And listen to your left lower quadrant. All right, everything sounds normal. I'll be sure to tell the physician about the tenderness you're feeling there. All right. Now, that is pretty much it. Let me help you back up to the sitting position. All right, I'm going to leave the call bell with you. And if there's anything else you need, let me know.
All right, thank you.
And I leave.